One of the scariest things that can happen to an anesthesia provider in the operating room is an amniotic fluid embolism. And if you know, you know. An amniotic fluid embolism happens when amniotic fluid or fetal cells enter the mother's bloodstream during labor or delivery. And it can trigger a sudden catastrophic reaction. And I mean catastrophic. Mom can stop oxygenating, blood pressure can crash, the heart and lungs can fail within minutes. Super rare. But when it happens, it's one of the most feared emergencies in obstetrics. And one time I genuinely thought it was happening right in front of me. It was during a C-section. Everything had been fine until the exact moment of delivery. I was taking care of the patient. She was doing awesome. Suddenly she says she can't breathe. She's having trouble breathing. Her oxygen starts dropping. She looks panicked, yet tired. Blood pressure is falling. She's getting lightheaded, getting hungry for air. And I remember, honestly, this wave hitting me internally like, oh my God, this is happening to me. The biggest fear I have in OB. Because in anesthesia, you're trained for these moments, but until they hit, you know the signs, you know the catastrophic response that it can turn into. And your brain instantly shifts into emergency mode while the outside has to appear completely calm and collected, because these patients are awake and their loved one is probably sitting right next to them. So internally, I'm thinking through every possible intervention. What do I have to do? While simultaneously praying, please don't let this be an amniotic fluid embolism. Starting to get worried. This is something people don't always see about anesthesia. We can look calm on the outside while mentally running through a worst case scenario at lightning speed in our brain. I started supporting her in the way that I knew and was trained to do. Blood pressure, oxygen, getting the medications that I needed to get. Thank God after 2 or 3 minutes, everything started to improve. Was it the medicine I gave for her blood pressure? Was it the 100% oxygenation? Was it her body's physiological response saying, not me, not today? I don't know. But sometimes in medicine, the scariest moments happen in seconds. Have you ever heard of this or known someone to go through this?